Hi, it's Dr. Hovis here today with our Wellness Wednesdays. Today we are talking about vaginal tearing. So we're just going to continue with our postpartum things they didn't tell you, and today's our last day. So like I said last time, I think there's a ton more stuff I want to talk about, but we're going to finish it up because there's other topics that I'd like to address as well. So you won't be hearing the last about things they didn't tell you about postpartum, but today's the end of the series for now. So vaginal tearing, I don't think anything sounds worse than having a tear in your vagina, but it does happen, and it's actually pretty common. I think the statistics say anywhere from 40 to 85% of women will experience some degree of tearing during childbirth. So that area is just really delicate, and it needs to stretch really far for that baby to come out. So, and sometimes it just doesn't stretch fast enough, and it can tear. So, I'm not sure if episiotomies are a thing anymore. When I had mine, it was never mentioned, but the studies are showing that it's just better to tear naturally than to get it clipped. But definitely talk to your doctor or midwife about it. I am not your doctor or midwife for childbirth. So look it up and have a discussion with your doctor or your OB or your midwife about it. So there's not any really foolproof thing you can do to prevent tearing. There was a great video I watched online, and I'll link it below, from I think she's a doula, of the different things you can do to help prevent. And it does help, but there's no, like I said, there's no foolproof way. So since we're talking about postpartum though, so if you do tear, it's not the end of the world. It heals really quickly. The stitches can itch, and it can be really sensitive. So the witch hazel pads that I know at St. Rita's, they give you witch hazel Tux pads, but I will link. There's a spray I found on Amazon. I have not used it, but it looked really nice, so I will link that too. That helps tremendously to help with the pain and itching. You can use your boppy pillow. Sometimes I think I should have bought 2 boppy pillows, because when you're sitting when nursing, it's nice to have. But also you can sit on it, and it just relieves that whole area too. So that's a different thing you can do to help with that too. But as far as care goes, the nurses at the hospital are awesome at giving you detailed instructions on how to care for it. And it's not the end of the world. So don't be too fearful of it. It does happen, and it heals up pretty quick. So that is the end of our postpartum series. If you have any other topics you want to talk about, feel free to message me, and we can talk about it next week. I'll talk to you later. Bye.